Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs. And welcome everyone to today's program, Eating and Nutrition with Pancreatic Cancer. I'm Katie Armsby with Cancer Support Community Atlanta. If this is your first time joining us for a Cancer Support Community Atlanta program, we welcome you and we invite you to visit our website to check out all the other virtual. We also have a lot of in-person programming that happens at our physical location at Sandy Springs, but we also have some great virtual programs as well. We have some support groups led by licensed mental health professionals, some stress reduction classes like yoga and Tai Chi, nutrition seminars like this one today. We also offer a monthly nutrition seminar led by an oncology dietitian with Northside Hospital Cancer Institute for those newly diagnosed to prepare you for eating and nutrition during treatment. So I do encourage you, if you haven't checked out that monthly program, please do so. And we also have nutrition seminars offered monthly with rotating oncology topics. So for any more information on all those programs, I encourage you to visit our website, cscatlanta.org. Our monthly nutrition seminar with Blair is coming up next Tuesday on nutrition myths. So please visit our website again if you'd like to register for that program or to see all the other programs that are offered virtually and in person. If you ever miss a live recording, you can visit our website and then click that video library tab where you can find all the other programs that have been recorded, which we have some great yoga, range of motion, gentle exercise programs, and education programs as well. So I'm excited to welcome Robin Benardot to this virtual platform with us. Robin Benardot is a clinical dietitian, oncology specialist at Atlanta Liver and Pancreas Surgical Specialist, working with GI oncology surgery patients. Robin has a long career spanning 4 decades working with many aspects of cancer care and especially pancreatic cancer. She recently celebrated 10 years with the Northside Hospital Cancer Institute. So welcome, Robin, and I will pass it off to you to begin today's presentation.
Thank you, Katie. It's really a pleasure to talk to you all. I am very aware that this is going to be kind of a dense presentation, but it's meant to increase your awareness about all the great things you can do for yourself in the realm of nutrition and self-care during pancreatic cancer treatment. This is a situation where you don't have a lot of control, but you do have control over what you eat and drink in most cases, and we as oncology dietitians are here to help you. The goal of this presentation is first to provide guidelines on what is healthy eating and lifestyle during treatment, also to identify disease-related concerns that require individual adjustments to your nutrition plan, and I'll show you a little bit about timing of that, and also to provide tips for managing common nutrition-related side effects. We call them nutrition impact symptoms. These are things that get in the way of eating. And then also to increase your awareness about the using supportive medications to help you manage these nutrition impact symptoms and be able to continue eating. So this is a little schematic of the timeline about cancer treatment, pancreatic cancer treatment in particular. So if we start with a sort of your diagnostic phase being the first little arrow here of a couple weeks, that's a period of time where you may find it important to think about what your current lifestyle is right now, your time management, the way you manage food, how regular your meals are, etc. It's while everything is getting sort of put into place as to your treatment protocol. The first part is usually chemotherapy, and I'm speaking from the viewpoint of working mostly in surgery, but I'm working with patients to get them to surgery based on these timelines. So they're extremely important to understand that at any time during these timelines, we can actually have different problems that need adjustments to our eating. So the first part, chemotherapy, is 2 months usually. 4 to 6 treatments on average, can be a couple of chemotherapy regimens. And then perhaps there's chemoradiation, 3 to 5 weeks. Other nutrition changes to your nutritional status there. And then surgery, and then chemotherapy. So if you look at this timeline, that's a lot to ask of your body to recuperate with each stage of treatment. So the wear and tear, as I like to tell my patients, can be significant if you're not really aware of the tools that you can use to keep yourself from getting sick during these periods. You're not meant to be sick the whole time. So this is something that I find patients will often fall into, this feeling like, well, I'm on chemotherapy, I'm supposed to be sick. No, you're supposed to ask for help from us. And we as oncology dietitians have a lot of plan Bs for you to use. So everyone needs a nutrition plan as far as I'm concerned, even in life. Being a dietitian, I can tell you, it makes a huge difference for people at any time in their life, but especially if you're having cancer treatment. So a plan is super important to think about. Why is nutrition important during treatment? Is that malnutrition can lead to weakness and fatigue, debilitation, and increased dependence on others for little things such as just even shopping, more ER visits and hospital stays, delayed or missed treatments, and need to sit in that chair in the chemotherapy room getting more IVs for hydration. So you want to avoid all these aspects. That's just a little snippet of why it's important. The big goal of nutrition is to prevent severe weight loss. So 50 to 90% of patients with pancreatic cancer can experience weight loss. Muscle loss impairs function. So if you lose weight, it's what weight are you actually losing? You're losing some fat, of course, but also probably half that amount in muscle. Stable weight is associated with improved survival, better surgical outcomes. So this is about preventing severe weight loss. I find also another area that we have to think about is our sort of cultural idea about what is healthy weight. And in a situation where you're having treatments that impair your function and can take muscle mass along with fat mass, overweight and obesity are not what we're targeting. There is a high sort of acceptance of weight loss, and maybe perhaps thinking it's even good, like I have extra weight, maybe I need to lose some, and this is the situation, this situation's not so bad. But actually, if you think about half that weight being muscle mass, and whether you can sit down in a chair and get up without using your hands, you're debilitated. So that's what we're really trying to prevent. And our culture kind of looks favorably at weight loss. So do think about that in this context, stable weight is associated with improved survival and better surgical outcomes. So we're always looking to really maintain a certain range of weight, and for every patient that is different. And you need to speak to your physician and your oncology dietitian about that. Healthy eating guidelines are available all over the place, but these are the ones that I would really recommend you kind of look at, which is the American Institute of Cancer Research. It's the World Cancer Research Fund. This is based on a lot of research. So this is something that we take very seriously. During the diagnostic phase, this is where you might want to think, where can I make a few adjustments in my lifestyle and my eating? So there's that healthy weight question. You may not be at a healthy weight at this moment, but that's fine. We'll think about that acceptable weight range for you at that time. But trying to go on a weight loss diet or losing weight at this time, it's not the time. Being physically active, everyone can be a little bit more physically active. See if perhaps you can fit in more walks or some kind of sport or whatever. But being active is important during treatment. The plant-based diet, which here is eating a diet rich in whole grains, vegetables, fruits, and beans. So what that means is plants. It does not mean becoming a vegan or a vegetarian. There is a place for all types of protein in your diet, but from the plant world, we get a lot of the phytonutrients that are very, very important in fighting cancer and in maintaining healthy cells. So it is important to highlight getting in fruits and vegetables every day and intact whole grains. Limiting consumption of fast foods if possible. I find that fast foods are often a problem for our patients, that relying on fast foods for most of your eating, or even, you know, your an occasional lunch, you may find that there's another type of maybe just a sandwich, a simple sandwich that's better. But fast foods are often not well tolerated with pancreatic cancer patients. Limiting consumption of red and processed meats. We're not saying to eliminate red and processed meats. I hear that from patients quite often. It's what they've seen with studies that 12 to 18 ounces of cooked meat, red meat, that's pork and beef per week, is not associated with increased cancer risk. So you don't have to worry about taking the red meat out. In fact, in some cases, it's your best source of iron, which is very important. Limit consumption of sugar sweetened beverages and limit alcohol. Pretty much should limit it totally, or avoid totally, or to limit. And do not use supplements for prevention of cancer. So these are all for the prevention of cancer, but we go back to these guidelines as our base guidelines for anyone that's gone through treatment and finished treatment. So when it comes to a baseline food plan checklist, to think about your particular habits, it's very important to have scheduled meals, high protein foods at each meal, plant foods, healthy fats, and lots of calorie-free beverages. So for scheduled meals, it's the digestive system is often quite congested, slow to operate, different digestive systems just from the cancer itself. So you want to set times for eating and think about the schedule. I reiterate this to patients all the time, because if you say, I'm not hungry, you still need to eat. So there's a situation where we maybe need to eat 3 meals a day minimum, but often more than 3 meals, 6 to 8 per day, because you may not be hungry. So that schedule of I eat my breakfast at 8:30, or, you know, snack at 10:30, whatever, to think about those timelines and kind of put them into your schedule. And perhaps you need reminders on your telephone. This is an important aspect of maintaining weight and muscle mass. Expect missed meals and plan ahead always. So you're going to have a lot of appointments with your physicians, and you'll need to have a plan B for having an actual, say, a packed lunch or some kind of a supplement. Largest meal of the day should be when you're the hungriest, and the last meal should be 2 to 3 hours before bed to allow proper digestion before you lay down. And think about eating with family and friends. That's a very good way to keep your appetite in check. For high protein foods, I mentioned that we're not talking about becoming a vegetarian or a vegan. This is not the time to go to any extreme diets or to change your diets really too much from your baseline. High protein foods at every meal and snack, every single meal and snack. First thing you do is you think, where's my protein? So what are good sources of protein? Fish and shellfish, lean skinless poultry. These are all very, very easily digested proteins. Lean cuts of beef and pork and other red meats, round or loin cuts. Soy products such as tofu or soy milk or edamame. Beans, peas, and lentils, which if you're not a beans, peas, and lentils eater, you may have trouble digesting those things. They may increase gas and intestinal gas. So that may not be the first choice for you during treatment. And then eggs, egg whites, egg substitutes, and protein powders. We talk a lot about and recommend protein powders of various sorts. I would say that whey protein isolate, that's whey, but not the concentrate, the isolate, so ISOLATE. That's a very easy to use protein source that you can add to many different dishes and drinks. But you also have rice, soy, pea, and egg white proteins that are probably not as, they don't disappear into a liquid or a dish as easily as the others, but they're also available and very high grade of protein too, also very acceptable. So for plant foods, 2 to 3 cups of vegetables are kind of the ideal. 1 to 2 cups of fruit. Choosing a variety. It doesn't have to be fresh. It can be frozen. It can be, if it's going to be low canned, it should be low sodium or fruit canned in juice. And then lightly steamed vegetables are much more digestible for patients than a big salad or raw vegetables. And then 3 to 6 servings of intact whole grains. So An intact whole grain would be brown rice or quinoa, if you've never heard of that, great grain. There are many good whole intact grains out there now to eat, much more than we had years ago. Oats and barley, and then whole grain products. A serving of a whole grain, because these are concentrated sources of carbohydrates, is about 1/2 cup is 1 serving. You may be able to have 2 servings if you're a man, 1/2 cup for a woman. And whole grain products, a slice of bread is considered a serving. So these being general guidelines. I put up here, this is one of my favorite things to make and to talk about, is everybody needs their good pureed vegetable soup recipe. I lived in France for quite a few years and learned a lot about cooking there. And this is a very standard French pureed vegetable soup that one would make. But the idea that I want to come across is that you can put a lot of vegetables together, cook them for a long time, even if you don't have a pressure cooker. This specific recipe recommends a pressure cooker, but you cook them in a broth or a water for a long time till they're really soft. And then you can puree them with an immersion blender, which is a little hand blender, very easy to use. They're really inexpensive. And something like this you can make one time and then freeze for 3 servings and have the first 3 servings for fresh in your refrigerator. Great source of vegetables. So maybe vegetables can be eaten as a pureed soup. This is quite delicious. You can flavor it any way you want to, but it's a great way to get your vegetables in, and also liquid. And for those of you who do like to cook, vegetable stocks are a great thing to have on hand. Chicken stocks and beef stock, which are found at any grocery store, to make these kind of soups or any sort of vegetable soup. This is a great addition to your daily eating. For high calorie, high fat food sources, fats are the best, of course. And these are some examples of good fat sources: olive, canola, and peanut oils to cook in or to use. Nuts, seeds, and butters. So almond butter, peanut butter, great source of calories and protein, and in addition protein. And then olives and avocados, and then coconut milk, which is one of my favorites because it has a kind of fat in it, medium chain triglyceride fat, which is easily digested because it does not need as much pancreatic enzymes. For pancreatic cancer patients, it's a great addition to drinks to add calories. A little 1/4 cup is an extra 125 calories. And less often to use butter or margarines or whatever. But these are concentrated sources of fat, of calories. They don't take up too much volume in your stomach. So if you're not able to get in calories, always think of good healthy fats to add to your meals. Hydration is super important. I always say you got to dilute the pollution of the chemotherapy treatments or any drugs you're taking. You need to dilute the pollution. The detoxification of drugs really depends on having lots of fluid. So calorie-free beverages for hydration are very, very important. Water's best. Find a water that you like the taste of. They do have different tastes. And you can put fruit slices in to give them some flavor. And daily amounts are between 64 and 96 ounces, but you have to be a little tiny person for 64 ounces. Usually I'm recommending somewhere near 96 for just about everybody. You can't count on the concentration of urine, the color of your urine, to say if you're dehydrated or not, but dehydration is a major problem in cancer treatment, and it can be remedied by having yourself a fluid schedule at the same time as you have an eating schedule. 100% fruit juices are another idea. Give you some calories, but in some cases you're not going to want to get the concentrated sugar. We'll talk about that in a second. Also tea, coffee. I'm not worried about caffeine unless you have very bad nausea and vomiting. Otherwise, go ahead and have your coffee. Popsicles, gelatin, soups, or broths. Pedialyte, keep some, if you don't know about Pedialyte, you can find it in the diaper section wherever you shop. A very common fluid replacement drink for children. It's a great, they flavor it now for adults too, but it's a great powder to have on hand that if you have diarrhea, you can replace fluid losses with Pedialyte. So I highly recommend having some of that on hand. Dilute it exactly as it says on the package. That's how it's meant to, so that you can reabsorb fluid from your gut. directly without having without losing more just straight, because you know how if you drink too much water, it'll kind of come through quickly. This is what keeps you from having that happen, and it will go directly to your blood volume, which is the source of the issue with dehydration, is low blood volume. Minimal, if any, alcoholic beverages, and if you're feeling full or having diarrhea, you might want to separate your large amounts of liquids from your meals, because it will take the place of food in your stomach. With the liquid supplements, not that you have to have a liquid supplement, but boy, do they come in handy. And we recommend them a lot, and distribute coupons for them, because it is often the case that you can't get the calories or the protein in. So for commercial supplements, there are many, many brands out there. Ensures, Boost, Carnation Instant Breakfast Essentials are some of the least expensive in the grocery store. There's Orgain, NU, and Cape Farms. They're a little more expensive. Wonderful supplements. Some of them are made from whole food ingredients. If you have any questions about them, always you can ask your oncology dietitian or email me. We have many things to choose from there. We target certain commercial supplements for certain situations, but everyone should have a backup of those on hand. The 350 calorie supplements are the higher calorie supplements. Those are like meal replacements, but you don't want to use them as a meal replacement, because you want to have food first. They should be used in between meals. But if you're on the go, you're stuck at an appointment somewhere where they're running late and you're in the waiting room far too long, you can always pop one of these if you're missing your lunch. And missing meals during these appointments, as I mentioned before, is a #1 cause of people getting behind in their calories and their protein and their hydration. So this is part of your repertoire of foods to go, would be one of these commercial supplements. Or, and also if you're diabetic, these are Glucerna and Glucose Control Boost, and there's some others. They don't have the same amounts of simple carbohydrate sugar in them, so they're recommended in these situations. But also high protein, low sugar versions are really available. They don't have any simple carbohydrates in them, and they will give you extra protein if protein is your issue or you're missing some of that. There are also homemade smoothies that you can do with protein powders. Our oncology dietitians here at Northside Hospital Cancer Institute, we have a lot of recipes to distribute to do your smoothies yourself. You can have, of course, you need to refrigerate them properly and make sure they're not at room temperature. So that's why the commercial ones can be better in some cases, but great to have something in your repertoire. Here is an example of one that I particularly like because of its great, it's a high amount of minerals, coconut water with almond butter or peanut butter or banana. And here's this whey protein isolate, which is very easy, a very easy source of protein. 2 scoops is 40 grams of protein. That's like eating 6 ounces of meat. You can add recipe variations. If you need more calories, you put some Greek yogurt into it, or you add that coconut milk I mentioned, easily digestible fat calories, and some flavorings to make it interesting. And if you're dehydrated, you add a little pinch of salt, like a half teaspoon or a little bit less, and some more water. So you can take a little simple recipe like this and tailor make it to your situation. Also, this one has about 500 calories in it too, so it's a really good recipe. So for dietary supplement use, I get this question a lot. It's a little tricky. Most people have come to appointments, their first appointment with us, with already a list of supplements. So I will say that it's important to minimize use during treatments, and your physician and an oncology dietitian can give you you can go through your list and give you a good recommendations about what you can keep, what you may want to minimize, or what you may only use on certain days of the treatment cycle. But it's used on a very individual basis, but they're not without harm. You know, it's something that supplements are not controlled like medications are. So you can have situations where there are impurities in them, or they are counterindicated according to your treatment. For example, folic acid is something you don't want to take high amounts of during certain certain treatments, like with 5-FU, which is a common chemotherapy drug used in pancreatic cancer. So please do divulge all of your supplements and get approval before using them. We want the best for you, and supplements are indicated in some situations and prescribed, but it's important not to add that to the burden of detoxifying treatments. Also, keep moving, very important. There was recently a study that showed that 7,500 steps a day for cancer patients during treatment is very beneficial. So it's not the 10,000, 7,500. Kind of work on that to get it in, but keep moving. Stand up every hour. Stand up if wherever you are, clock strikes the hour, stand up for a while. We've got some reminders on our watch. If you've got a smart watch, use those, but it's important not to sit. Schedule naps if needed. It's normal to be tired. Very good to be well rested. Schedule a nap, but don't spend the day in bed. Every day you spend in bed without moving, you can lose a tremendous amount of muscle. I've seen figures of like a pound a day of muscle for people who are bedridden. It's pretty scary. You're meant to move. We're meant to stay upright and keep as mobile as possible. Safe muscular exercise, approve this with your physician, but there's a lot of move for patients to be getting some kind of a lightweight training or TheraBand training, but to keep your muscles in action. And you can get recommendations from physical therapists, or if you can, a referral to a physical therapist during treatment. But the point here is that light exercise is important. It helps you, it helps stimulate your appetite, and it keeps your muscle mass intact. So that's something don't forget about that part as part of your nutrition plan. Nutrition adjustments based on specific individual concerns. This is where things get a little trickier. So those were general recommendations. So here's a little picture of our abdominal cavity, our digestive system, and we see the pancreas here. So the pancreas is, you have 3 different parts, basic parts of the pancreas, but see where the yellow is on the drawing. This is where your pancreas is, behind the stomach. Look at all the possibilities of issues that would get in the way of eating. Here's your stomach. You can have this early fullness, delayed emptying of the stomach, all this congestion that can occur. This is a key organ for many digestive processes and the metabolism of glucose, insulin production. So everything about pancreatic cancer treatment with nutrition impact systems involves your eating processes and digestive symptoms. So very, very important to remember that many things can happen, and it can, your side effects can evolve during treatment. The one aspect of the medical surgical history that we always look at is whether you're diabetic or pre-diabetic. In our practice at Atlanta Liver and Pancreas Surgical Specialists, we always do A1Cs on people to get a baseline at the very beginning. And the hemoglobin A1C is your average blood sugar over about a 6-week to 3-month period. Key to see where you run along that continuum, because you may be on a trajectory towards diabetes that you don't know about before you're diagnosed. And treatments can add a burden to your ability to manage blood glucose because of the steroids that are given to manage side effects. They're meant to help you manage the side effects and given as a supportive treatment when you sit in the chair before you get the chemotherapy. So that will raise your blood sugar for about 5 days after you eat. So if you already are having trouble with higher blood sugars, this can push your blood sugars even higher and push you into diabetes and become a problem. So we want to look at that part and check it out all the time to make sure we're giving you the right kind of information. As far as nutrition is concerned, of course, it's going to be carbohydrate management. There may be medications involved, but for a dietitian, we're working with the medications and we're trying to in some way decrease the volume or the amount of carbohydrate you're having at a time. In diabetes management, this is called the consistent carbohydrate diet. And I may, as to my patients, speak to you about the amount of high carbohydrate foods that you should have at a meal to not go under this and not go over this. So give you some guidelines as to what serving portions are appropriate for you for carbohydrate intake during a meal. We also want to be able to not promote weight loss. So we're not going to put you on a calorie restrictive diet or make changes to we'll recommend changes to medical management to allow dietary flexibility so that you'll be able to eat what you want on, or what you can eat on days when you're not feeling well. So if on a day when you're not feeling well, if all you can eat is mashed potatoes and drink apple juice, you should be able to, because you need to eat, the calories need to come in. So we have to have manageable medical management of the diabetes during that time too. The higher risk of prolonged fullness is really a big deal if you have out of control blood sugars. So the medical word for this can be gastroparesis, and we can see someone's they're not emptying their stomach very quickly. So that's the kind of questions we'll ask you from head to toe about your symptoms that you're having. If you're having trouble emptying your stomach, like you feel like you're full for a very long time, I can't eat dinner because I'm still full from lunch sort of feeling. It is much more common for someone who has diabetes or who has high blood sugars. So managing blood sugars from the digestive level is also important. Pancreatic enzyme insufficiency. You may or may not have heard about this if you're new to the pancreatic cancer situation. When someone comes to us the first time, we're always asking about what your usual pre-illness weight is. And sometimes it takes a little bit of sleuthing on the dietitian's part, because there is also that, as I mentioned before, sort of the cultural value about it's good to lose weight. So what I might hear is, yes, last summer I lost 30 pounds. It's the first time my diet finally worked. Well, it wasn't the diet working, it was the pancreatic cancer. So unexplained weight loss can occur very easily before treatment or before diagnosis for pancreatic cancer. That this is one symptom that may mean there's pancreatic enzyme insufficiency. So the pancreas produces an array of pancreatic enzymes managing the breakdown of your food into pieces and molecules that you can actually absorb into your intestine. So if you have pancreatic enzyme insufficiency, you're not going to be absorbing your food very well, and it's going to come through your system with changes in your stool. So at the stomach level, you may feel a bloating or indigestion after meals. I eat, I feel bloating, I feel cramping, I can hear gurgling in my stomach. That's a symptom. Increased intestinal gas, like everyone has gas, right? But this is increased intestinal gas with a smell that is very atypical. Also, more frequent stool. You can say, I used to go once a day, now I go 6 times per day. And don't feel timid about asking these questions. Or answering these questions or complaining, because these are something you're going to be faced with, these direct questions from your medical team all the time. More frequent stool is one. So from your baseline, if you were once per day and now you're 4 times per day, that is a symptom you could have pancreatic enzyme insufficiency. Then also light, pale, or yellow colored stool. That's another thing. You can have different colored stool. You can actually see an oily ring in the toilet where fat is coming through your system unabsorbed. So think about this. If you have these kind of symptoms, calories are coming through unabsorbed. You're going to have malnutrition of macronutrients, so your protein, fat, carbohydrate, plus your micronutrients. So all the fat soluble vitamins can not be absorbed also, because they won't be cleaved from your food and into a form that can be absorbed by your digestive system. This is all something that is really remedied, but you need to bring these symptoms up to your team. Believe me, if you see me, I'm going to ask you, but Creon is what we usually recommend, but there are many pancreatic enzymes that are prescribed. The over-the-counter ones you see online don't work. They anecdotally, some people say they do, but we don't even bother with them because this is the real deal. It's creon or some kind of other digestive enzyme. We usually dose them. This is a typical dosage, 2 per meal, 270 of these little capsules per month. That's a lot. You're taking them with the first bite of the meal. So you eat a bite of food, take a capsule, eat a bite of food, take a capsule for one full meal. The other medication we use for this is an acid-reducing medication like Pepcid or pantoprazole, because the pancreas also produces bicarbonate, which is secreted into one part of the intestine that helps reduce the acidity of the contents of your stomach. Remember, your stomach is so acidic that you would burn your hand if you could touch the acid in the stomach. So our wonderfully intricate functioning bodies actually have a very nice scheme for reducing that acid. And it will go awry too if you don't have enough bicarbonate from your pancreas. So you're going to have to prescribe also or take a pantoprazole, which is another thing we recommend a lot of. So these medications are something that, as an oncology dietitian, I work a lot with physicians about this, make suggestions, recommendations to them for prescribing. The physicians prescribe. We may help titrate the doses, help you manage the doses, educate you on when and how to use them. But it's extremely important to help you keep your weight and lean mass during pancreatic cancer treatment. See my time frame here, okay. Treatment relating eating adjustments. We've got a lot of different nutrition impact symptoms that can happen. So poor appetite or absence of hunger cues is one thing, but if someone tells me they have poor appetite, it's usually they're having taste changes, nausea, bloating, early fullness, gastroparesis, constipation, diarrhea, or loose stool. All these types of nutrition impact symptoms get in the way of good nutritional status, but it may need a dietitian or someone really good at sleuthing this out, because if you come to someone and say, I have poor appetite, it may lead you down the wrong path. So what I try to do in practice is figure out, why is the appetite poor? There's usually a reason behind it, and often it has to do with not using the supportive medications that you're prescribed by your team to manage these symptoms. You get quite a few medication prescriptions that say PRN as needed, and it's in my experience that people don't use them enough. And the number one problem is often for this situation is nausea. Remember, if you're feeling like, yuck, I don't want to eat, you have nausea, you have mild nausea, prevent it from getting worse, take your nausea medications. Any questions about that, ask your medical team, but it's often an issue. We already talked about bloating, early fullness, prolonged fullness. We'll talk about taste changes in a second, but constipation is another one. Pretty much need to go every day. If you don't, ask your medical team about some kind of a bowel regimen. You need to increase your fluids for sure if you're not going every day, and you may need a fiber modified diet. Not the time to take fiber supplements during treatment without consulting with a healthcare professional. This is the oral care treatment, really looking at the shape of your mouth, your tongue. Check it out every day. Don't use really strong mouthwashes like Listerine. Your mucosa in the mouth mirrors what's going on in your intestine. That's one huge tube starting with your mouth. You need to make sure you're not having erosion of the membranes of the mouth. Ask your team about getting something like magic mouthwash, but this gets in the way of eating big time for pancreatic cancer patients. There's a method called the FAST method, which is the combination of food and adding spices, etc., that to manage if you have a metallic taste, too sweet, too salty, too bitter, etc. There's ways to add little bits of something like sweeteners or lemon juice to counteract these tastes, so the food tastes more normal for you during treatment. That's specifically for chemotherapy patients. It's a very interesting combining of food. We have good handouts on this stuff. This is just a very short summary on it. The other is please use an oral care rinse because you're not going to use Listerine. Oral care rinse is 3/4 teaspoon of salt, 1 teaspoon of baking soda, and 1 quart of water. Put that out on the counter, swish and spit with it before you eat. It'll help you maintain the mucous membranes in your mouth, and it will help you reboot your taste buds. So it's something you should use faithfully. There are a lot of different recipes out there. This is the one you want to use because others are too strong and may erode the mucosa of the mouth. So diarrhea treatment can be quite complicated. This is something you really want to work with your team on. There are medications we can use. There are certain ones that are prescribed, some over the counter, but there are some prescribed medications that are essential with certain types of chemotherapy regimens. So it's also something that asks that question. You're not meant to have diarrhea, you're meant to control it. Let your team know. Dietary interventions are increasing soluble fiber. So think the brat diet, think rice and applesauce. Adding some good white rice to your meals can really help that. And there's congee, which is a rice cooked in 1 cup of rice and 6 cups of water. Very thick kind of soup that helps a lot with diarrhea. Oftentimes medications are prescribed, but then people still have diarrhea because they haven't changed their diet. So we have specific dietary recommendations for diarrhea. Also, that Pedialyte comes in handy at that time. There is a really good little online webinar, I was going to say course, but webinar to help you manage side effects of treatment that the Cancer Support Committee, Cancer Support Community is providing every month, called Newly Diagnosed Nutrition 101. And they go through all these side effects of treatment too, and some of the remedies. But again, if you ask your treatment team here at Northside, oncology dietitian is a necessary referral. And we have handouts for all of these symptoms and how to manage them. So I work in the surgical arena, and pre-surgical nutrition optimization is extremely important. We call it prehab. And so once you've gone through your prescribed chemotherapy, if you have chemoradiation, there is a short rest period of about 4 to 6 weeks before you do treatment. And this is if you're seeing me in our practice at Atlanta Liver and Pancreas Surgical Specialists, you're going to have a little plan for prehabilitation, so preoperative nutrition optimization. It's about we're looking at putting you into an anabolic. That's a fancy word for saying I can actually repair and make new tissue state, because in order to have these surgeries, you need to be able to prove to us that you can actually make good tissue. So the first thing we do is put you on a high protein diet, and that's about 0.7 grams per pound, to use US measures. 5 servings of protein per day, 1 for each meal, 2 in between meals. We use whey protein isolate or medical food supplements as part of this regimen. We also encourage activity. We want people to be in good physical shape for these surgeries. And we use a supplement that's a wound healing supplement called Juven. We preload patients with that beforehand. Helps wound healing by increasing blood flow and also building collagen. So if we get you really pumped up with high protein diet, some good activity, healthy as possible, loaded with a wound healing supplement, you're much more ready for surgery. Postoperative nutrition goals are the same. We have the wound healing, we have Juven, we continue that. I'm going to skip ahead for a second to show you something here again. Remember the pancreas here? Well, this is one of we have distal pancreatectomy, and we have our most interesting surgery, which is Whipple surgery. So this is the new connection here without going into a lot of detail. Here's your stomach. You have a new connection to a new part of the intestine. You have the first part of the intestine is removed. Your pancreas, the head of the pancreas is resected. So you don't have the digestive enzymes if you had any before, hardly at all after that. So you need digestive enzymes. You have impaired glucose control because the pancreas is affected. So you can have higher blood sugars. So all this requires a rebooting of the digestive system. So with our post-operative nutrition goals, it's all about adapting to the surgery, and it's called a Whipple nutrition therapy. And we do the same thing, high protein and Juven, but we also do pancreatic enzymes, and we're working with each of these things on with you at each meeting, and you meet with me several times. So you're meeting with me about 6 times probably after treatment. And I'm going to show you this here. It's in the Whipple diet is 6 to 8 small low-fat meals. You drink fluids between meals. Remember, stomach volume. If it's you have fluids with your meals, there's too much in there, you may not get as much food. So you separate the liquids. No concentrated sweets. You're not having apple juice or cake. You're having less things without sugar and drinks without sugar. You're having pancreatic enzymes with each meal. You're having that acid suppression medication, and you're having possibly motility medications. So all of this is something that is very individual, but as a dietitian, I'm working with all of these aspects to do what I call a reboot of your digestive system. It's like a hard reboot. So the system is a little bit lazy after the surgery because the connections are new. So what this diet does is promote very frequent eating. So you're giving a stimulus every few hours to the digestive system to work. And lo and behold, after a few weeks, you're actually digesting very nicely. So it's a method that gets you back to a new normal, which may mean you can't have an enormous Thanksgiving meal anymore. You're going to have a smaller one in several sittings, but you're going to have really very normal digestion afterwards. It also may mean you're on pancreatic enzymes for maybe life, maybe only a while, but it's a very new normal and a good normal that you're at after these surgeries. So if the endpoint is a surgical resection of your tumor for you, this is what you would have to look forward to, and also to the guidance you get from an oncology dietitian. So in conclusion, I know it's a lot of information. Each little area: chemotherapy and nutrition side effects, radiation gives you other side effects. Nutrition is a key component of this. Malnutrition is common and with the pancreatic cancer diagnosis, and prevention is key. Your oncology dietitian can help you sleuth out eating difficulties and find your plan B. Everybody's different, and we're all here to help. So thank you for listening to this. Time was very short. I will entertain any questions you may have right now.
Thank you, Robin. And we do invite everybody to enter questions into the program chat box. We did get a few come in while you were presenting. One of the questions was related to protein. So if I'm still going through chemo and not in a prehab state, should protein be a focus? And if so, is there any advantage to protein through solid foods versus powders?
First, I'll say that solid foods, normal food first. Let's say food first. That's always most important, is to get your nutrients from food, because they're not isolated. Where a powder has only protein in it, and usually not all, perhaps the phytonutrients, if you're combining your protein with vegetables or whatever, you're getting a wider range of nutrients by having food first. Yes, protein is important for everyone. I'm going to say that protein deficiency is not usually an issue for most people, but optimization of protein is always essential. So if you're over 65 or even 60, 1.5 grams per kilogram or 0.7 grams per pound is a good thing to shoot for. So I would say, yes, protein is always important. And if you don't eat that much protein, you might want, there are a lot of ways to really kind of look at your individual intake and see where you lie with that. But yes, protein is always important, and more so with these other areas of treatment, but yes, always important.
Okay, and along with the protein powders, if those are somebody's preferred choice, is there any preference as far as soy versus whey?
Um, no, I don't think so. I think they're all pretty equivalent. You wouldn't want to get all of your protein from powders. There is some information about certain amino acids. So amino acids are components of protein. So leucine, that if you get too much leucine, which is part of whey protein isolate and soy protein powders, that you can actually suppress the anabolic capacity, or so the healthy cell making capacity of protein. So you wouldn't want to get it purely from those powders. But between those two, they're pretty similar. And the way they're actually manufactured now, the only difference I would say is taste. Do you actually find it palatable? And whey protein isolate kind of disappears. Soy protein, you usually can taste it.
Okay, so diversify your intake. Another question came in: prior to starting treatment, should I try to increase my daily caloric intake?
No, it depends on where you are on the scale of weight. And if your baseline is where you are actually, how I look at it is, you're keeping your weight where you are, I would stay the same. There isn't a huge difference in calorie needs, in energy needs when you have treatment. You just need to have enough to maintain wherever you are, if you're at the right weight, or your weight is stable at the moment. If your weight is not stable, your caloric needs go up, of course. So that's where we have increased needs. But the treatment itself is not requiring you to increase your calorie intake.
Okay, I think this is a kind of a similar question. I've been recently diagnosed and am wondering what my daily caloric intake should be. At what point can I kind of expect to meet with a dietitian?
A basic guideline is that if you are at I'm going to go to BMI. Okay, if you know your BMI, that's your body mass index. If it's less than 25, you're probably going to be at something like 25 kilocalories per kilogram. So for most women, it's hard because it's weight and height. So we have formulas we use, but it's 25 calories per kilogram. So take your weight, divide it by 2.2, and then multiply it by 25. You're going to get a calorie number there. And that gives you an idea of a basic calorie need for someone that's at a normal weight and has a stable weight at the moment.
Okay, thank you. And this question goes back to kind of moving and keeping active when possible. Is there a preference to maintain muscle mass in maybe doing some lightweight work versus an aerobic workout?
Well, of course, this is not my specialty area, but it's general knowledge that you have to use muscle to build it. So aerobic exercise, if you're cannot be as favorable to that, because you're not really putting stress on your muscles. So that's why I mentioned something like TheraBands, which a physical therapist could recommend for you, but they have different advantages for muscle mass, and muscle mass should be weight bearing, if that answers the question accurately.
Okay, thank you. And if anybody is interested in light kind of range of motion exercises, we do also offer chair yoga, light, gentle exercises like that, and Tai Chi. So again, visit our website if you're interested in any of those. Another question that came in is, I'm 8 years post Whipple and I'm severely vitamin D deficient, which is now affecting my bones. What can I do dietary wise to address this?
I would, if you were my patient, I would first look to see if you're on pancreatic enzymes and if your dosage is correct, because you may not be absorbing very well. There isn't a clear test. There are several absorption tests for pancreatic enzyme insufficiency, but I always say it's a little art to the science. You know that it exists after a Whipple. So if you're severely vitamin D deficient and it's affected your bones, perhaps you need pancreatic enzymes. So that's one question I would put out there for my physicians. And you do need vitamin D replacement, and that's something that your physician can recommend for you too, and also prescribe. Probably need the pharmaceutical replacement for a while, and then having regular vitamin D lab tests to make sure you remain normal. But it's very common to see vitamin D deficiency with pancreatic enzyme insufficiency.
Okay, I think that might be rounding up most of our questions. I do want to remind folks before we leave that next Tuesday we'll be having our nutrition seminar on myths, nutrition myths, kind of busting some of those, and we'll also have time for a Q&A during that as well. And then next month we will have our last for this year Nutrition 101 seminar that you can join to learn more about eating and nutrition during treatment. We did, Robin, have another question come in. Any idea maybe connecting to more affordable versions of Creon?
Yes, and I also realized I didn't answer a question when someone asked about how to get a referral. You need to ask if you're with Northside Hospital affiliates. You need to ask for a referral. In fact, it's supposed to be an automatic referral to a dietitian if you have a pancreatic cancer diagnosis. You are supposed to be referred. So do request that of your physician. And what was your question was about? What was it again, Katie?
Yeah, what the last question that came in was any idea or thoughts on accessing a affordable version of Creon?
Oh yes, affordable versions. Yes, it's terribly unaffordable. So if your insurance is not managing it, there's a couple things. Make sure that you have the exocrine pancreatic insufficiency diagnosis. So that's something that your medical team needs to put on there, because your insurance will reimburse differently if it's not on there. The other is that there are all of the pancreatic enzyme formulas. Your insurance company has a preferred formulation. So make sure that you're being prescribed the preferred formulation. As I said, there are other brands out there that can make it more affordable. The other is that there is, with each one of the brands, they have a patient assistance program that your medical team or dietitian can help you apply for. And it's a very simple process. And we have a lot of our patients have an entire year free from the companies. So don't give up on it because of the cost. There's assistance out there for you to apply for. It's a simple application.
All right. Thank you, everybody, for entering such great information. Again, I'm going to encourage everybody to visit our website, cscatlanta.org, if you want to connect to some of the virtual and in-person oncology programs that are available. Robin, thank you so much for being so generous with your time and expertise. Before we close out, do you have any final thoughts you'd like to share?
If you're in the Northside Hospital Cancer Institute umbrella with your treatment, Georgia Cancer Specialists, Atlanta Cancer Specialists, Suburban Hematology Oncology, Northeast Georgia, any of those oncology practices, you have access to oncology dietitians. We have a wide network here in Georgia. In fact, I've been told one of the widest networks in the whole US. So we're here to help you. The cancer support community is a fabulous resource, and please partake of their programs. The nutrition and exercise programs are wonderful. They really can benefit you, and they're a great place to network, meet other people, and realize you aren't alone.
Thank you, Robin. And we're so grateful to you and the entire dietary team with Northside Hospital. You guys provide couple monthly programs with us. So we do encourage everybody to connect to those resources. And if you'd like more information about Robin, you can visit Atlanta Liver and Pancreas Surgical Specialists at their website. And if you know somebody who was unable to attend today's live program, we encourage you to let them know they will be able to find a copy on our video library tab at our website. So, all right, everyone, thank you again for joining us, and we hope to see you soon. Everyone, take care.
Bye.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.